Morning, Jack. How you going?
Good morning.
Let me just turn my volume up there. I hope Chantel didn't give you too much of a brief before you've hopped on today. I'm excited about the fact that you don't really know what questions you're going to be asked.
I have no clue. She didn't tell me anything.
Yeah, awesome. That's great. So a little bit about me. My name's Oliver. I'm 19. I'm from Tasmania, Australia. So I'm sure we'll get into the implications of living down here at the 43rd latitude. And I want to mainly talk about the effects of concussion on the body. And I mean, this is absolutely in your wheelhouse. And I'll be using myself as an example a lot because I've suffered from a head injury, which has caused some other injuries, and I'm excited to get into their implications throughout the body.
Doke.
Awesome. Alrighty. So first of all, I just want to give you a little quick background. I am recovering from a condition called cervical instability, and this came about from a pretty serious concussion that occurred in a soccer game, and it's had quite a few effects throughout the body, and it mainly affects the vagus nerve and the internal jugular vein. Now, I'm sure just from that, you understand that that's got quite a widespread effect throughout the body. But one of the questions I wanted to ask you about that is how does a fascia injury or a collagen injury affect semiconduction in the body?
Well, I mean, that one's pretty simple. Collagen is piezoelectric and flexoelectric. So when you have damage at some level, that means you have decreased ability to turn electric signaling into light. If you can't do that, and you're missing some of the spectrum of light that we need to drive our internal biochemistry, there's your answer.
Okay. Okay. And with that, I've got quite a rigorous fascia training program. I'm working with one of the best people in the world. And when I started this program, my synthetic clothes, they started sticking to me. Is that because of the piezoelectric effect?
No, called static electricity.
Okay. It hadn't happened before, and I was wondering if it might have had a link, but obviously not. And with that, with any problems with cervical instability, what sort of effects does that have with being able to bring in light and process light if that goes untreated, or with any collagen injury?
It's not a problem of bringing in the light. It's a problem of distributing the light. I mean, remember what collagen and fascia is in your body. It's like the electric power grid. It's not the source, but it's how things get distributed in the body.
Yeah, okay. Awesome. And yeah, as I said, this issue occurred from a concussion. So when that happens, one of the main things that happens, as you would be very familiar with, is being light sensitive. And from the mainstream, we get told to put on sunglasses to try and combat the light sensitivity. I'm going to go out on a limb here and assume that that's terrible for you. So what sort of implications does that have to recover from a brain injury when we start to block the light coming in through the eyes?
Well, I mean, the first thing you need to know is that all neurons require light. In fact, I always tell people that when an action potential through a neuron happens, you need free T3, which is thyroid hormone. You also have, during the action potential, water moving across the neuron from one side to the other. Realize that mitochondrial metabolism is where the water is created. So if you can't create that water soliton in the nerve and you don't have enough T3, because T3 is actually created from tyrosine and phenylalanine, which are aromatic amino acids that absorb UV light, then you can see that advice that mainstream centralized science gives you is just total hogwash. Why? Because you need UV light exposure through the eye and the skin actually to generate the two chemicals that neurons need to work. And without those, the redox potential of neurons drops. So when that occurs, when you add on the collateral effects, for example, the piezoelectric effect loss in collagen is a collateral effect of this. It's almost like the whole system, when you have a TBI, is undergoing a brownout, similar to what you would see, like, say, at Fukushima, when a tsunami hits the nuclear power plant, there's no more electric power distributed all over, Hokkaido in Japan. That's kind of what a TBI is like. And then where the power grid is disturbed the most, where the redox potential is the worst, that's where the symptoms will manifest.
Yep. Yep. Okay. Awesome. And so on that, when you do have an increase in light sensitivity from a concussion, what are the best ways to try and bring that down and recover from that? I'm going to assume it does include getting out into the sunlight, but how are we going to overcome the light sensitivity for some people not really even being able to open their eyes that much before it gets too much?
It's not going to be standard answer getting out to the sunlight. You need AM sunlight specifically.
Yep.
And midday sun is not the best thing for people with a concussion. Why? Because when you have a concussion and you have damage to the power grid in your body, if you overwhelm it with a huge, strong stimulus of light, you can actually blow out the system. That's part of the reason why they're so light sensitive to begin with. So you need to start back from the beginning. Once you use AM sunlight, then you can start to use infrared A light, like this photobiomodulation. And what is the purpose of photobiomodulation? When someone is broken down, photobiomodulation actually increases ATP production within the body. That's one of the first things that has to happen before you can recapture the redox potential in neurons. So you generally graduate up, and depending on the severity of the concussion and the symptoms, it depends how long you'd have to do it. There's no one answer for any one concussion because no single concussion is the same. And then if you've had multiple concussions, the problem is usually worse over time, especially when you're younger. And there's the other issue. Concussions are much more severe in younger people than it is in older people. Part of the reason for that is they don't have any protection of myelin when the injury happens, which is, above the age of 25, you tend to have some of that protection. So it's a complicated, long drawn out process that unfortunately most people with concussions don't even realize. All these little steps and all these little things, they never get told this by the neurologist or the neurosurgeon they go to. They get told, oh, do this, do that. And many times it's not done where you need to start from the beginning and work your way up. So it can be a huge mistake. And then obviously with decentralized advice out there that the sun is bad for you, that's just an epic joke. And then you have to consider if you get injured and you have a problem, where the latitude that you live. And that could be either at the equator or really far away. The acute phases of a concussion being at a low latitude really doesn't hurt you. Gracias. It really doesn't hurt you. And being at equatorial environment initially can really be bothersome. Very few people get told that information. And I think that probably the biggest thing that frustrates people with concussions is the advice that they get from neurosurgeons and neurologists is very uneven. Why? Because neurosurgeons and neurologists really are not learning the biophysics of how the brain operates. Like I can tell you, I've had conversations with neurosurgeons myself who take care of professional players like I do. Most of them don't even know that an action potential creates a water wave in the neuron. Even fewer of them know that T3 levels correlate with neurologic function. In fact, neurons don't work when you don't have enough free T3 in them, which is the reason why people that have hypothyroidism tends to have so many neurologic problems. For example, the syndrome that everybody's talking about right now, which mimics a TBI, is long COVID. Why? Because it's a fundamental problem with mitochondrial redox power. And when you have symptoms of long COVID and there's cognitive haze and cognitive delay, you can almost always do labs on the person and find that their T3 levels are really low. And most people never tell them, what the teleologic cause of that is. It's because you have to convert phenylalanine and tyrosine, through the process of the hormone panel to create those things. Most people don't even realize that is actually how you make thyroid hormone.
Yeah, wow, awesome. And you mentioned that when you get multiple concussions, which I have, and many of the people that I know in the sporting community have had, what happens then when you start to stack those up? What extra things are going to happen that you're not really going to be
Brain
able to
doesn't
recover
bounce
from?
back. Your brain doesn't bounce back. In other words, you never get back to the place where you are. I mean, I know you're from Australia, but I'll give you, I used this on another podcast, but it's really, really, I think, important to talk about now. We have an NFL football player plays for he used to play for the Indianapolis Colts. His name is Darius Leonard. He was an all-pro linebacker for the first 5-6 years of his career. He got a couple of back injuries and he had a couple of concussions, and they were stacked up right together. He just got cut from the Indianapolis Colts like 2 or 3 weeks ago. So how do you go from being an elite athlete to being a guy who you throw away? I mean, remember, this guy was making, I think he signed like a $60 million contract a couple of years ago. But in the first 2 years of his contract, he got all these injuries. So when he's so recovered from the injuries, they put him back on the field, and he looked like he was really slow, out of place. He didn't look like the same player. That is evidence of a mitochondrial redox problem. And, you know, many of the people like on ESPN and the NFL, like, oh, well, he gets cut from the Colts, some other team will sign him. Well, if some other team watches this tape, no one will sign. In fact, the smart move for the player is he should never play football again. Why? Because of what I just told you. Like, if you get multiple injuries and you stack them up against each other, you never get back to the level you were at before. And say if you go back to the sport and you do it again, then you're starting to deal with Alzheimer's, Parkinson's, frontal temporal dysplasia. In other words, then you're going to get the pathologic problems that are associated with mitochondrial thermodynamic problems. And of course, nobody who's 19 years old wants to hear this, but I don't really give a shit what you want to hear. I'm going to tell you the truth, because Darius Leonard is only 25, 26 years old. He's only a couple of years older than you. And we see this all the time. And in NFL football players, it's really well documented over the last 20, 30 years that these players who suffer these type of injuries that affect their collagen, that affect their cognition through mitochondrial problems, they wind up with CTE much more frequently when they're in their 40s and 50s, or they wind up with serious neurologic problems. And when you see them when they're 40 and 50 years old, they don't look like a normal and 40 and 50-year-old. Why? Because the heteroplasmy rate in the tissues that they've had damage is so much higher, they appear like a 70 or an 80-year-old human. And this is very counterintuitive to modern centralized medicine, because we think that normal aging, you know, has a rapid onset. What people don't realize is the way mitochondria works, you're only as strong as your weakest link. So if you destroy mitochondria in certain tissues and you don't properly rehab them back via quantum biologic perspectives, you are going to leave yourself with functional tissue loss that's irrecoverable, even when you figure it out down the pipe.
Okay, that's a very in-depth answer, and I appreciate your honesty. And at no point do I want you to try to appeal to me, and I'm sure you definitely won't. On that, I know you've talked about before, and I think it was probably in this same podcast, that the time perception was one of the big things that got impacted. What are some markers that we can take to know whether this is something that you can't recover from, or this is something that you can bounce back from?
No one knows the answers to that. Everybody right now, it's the holy grail of TBI science to find cell markers. I don't think cell markers are very effective in TBI yet. I think ultimately what's going to happen, we're going to use quantum biologic ideas. There's something called the Kashi rule and an anti-Kashi rule. And I don't think right now modern centralized science is aware that we have a need for endogenous photomultipliers in neurons. Now, we're beginning to use these techniques in science. We're beginning to use optogenetics. We're beginning to use fluorescent dyes. We're beginning to do things like that so that we can check how biophotons move in a system. The problem is we're not ready to bring that to prime time yet in the clinical medicine. I think decentralized medicine will be the first people to make those moves. And this move is very similar to what happened with Fritz Popp in the classical physics world when he built photomultipliers and showed that every living thing creates a spectral frequency in the ultra weak UV environment. That information from the 60s still hasn't even translated to modern centralized medicine now. So we're a good ways off. And the fact that the TBI scientists right now are still focused on biomolecules, in my opinion, shows you how far behind the curve they are. Why? The biomolecules are like ghosts of the real problem. To really understand TBI well, you are going to have to get spectral frequencies to see what frequencies are missing inside the cell. Like, are you missing, I don't know, say 150 nanometers of light in the infrared A range? This is going to affect all the things that work via heme-based proteins in the body, like cytochromes, like hemoglobin. We don't know the answer to that. Or for example, if you're missing stuff in the UVA and UVB range, you're going to have problems with apoptosis and mitochondria. So that means you're going to work on mitochondria that are much older. That's like one of the things I think that's going on in long COVID. But you don't have people who are facile enough with this science to understand these things. So what do? They try to explain things based on the understanding they have today, which is why scientists keep talking about, markers for TBI that are biochemical markers. I think that is going to lead to a lot of half-truths and a lot of problems clinically for people with TBI. I don't think it's a good idea to focus in on biomarkers. I think it's going to be a fruitless endeavor. I think the key is getting straight to the spectral frequency level. And as I've said, we now have endogenous fluorescent proteins, or I should say chemicals, that we can inject into proteins where we can actually get samples to see what's really going on. Like I said, it's not ready yet for human use, but we are already doing this in animals. And that tells me that we're not very far away from realizing the implications of this work for human biology.
Yeah, awesome. And I've seen you have mentioned, it might have even been on the Human podcast, that sometimes in your lab you use not in your lab, in your work you use a big magnet to try and help the ATPase spin. Can you talk a bit on that and how that helps recover from concussion? And is that more for the early stages or for later on too?
Well, to be honest with you, you probably could use it in the early stages, but again, in centralized medicine, no one's doing this. The reason why is because they don't understand functionally how this works. So just think about the sun. I already told you how to use the sun. What is the sun? It's an electromagnetic source generator. So realize that light waves have an electric field and a magnetic field. What a transcranial magnet effectively does, it delivers the magnetic flux that's normally present in light to help you. Now, why is that good? In medicine, centralized medicine, specifically psychiatry, uses electromagnetic pulses to treat depression, which is one of the problems with TBI. We have something called electric shock therapy, but to do that, to put a DC electric current through the brain, you generally have to put the patient through general anesthesia. The big advantage when you use transcranial magnets, you don't have to do that. You can actually put a ring above the damaged part of the cortex and deliver magnetic flux. Realize what you're doing is you're generating photonic energy in the brain to make the ATPase spin faster, to make more ATP. So we're back to that same modus operandi, how photobiomodulation works. So realize that photobiomodulation does it, sunlight does it, transcranial magnetic stimulation does, but they're doing it to different degrees. And the thing that we don't know which one is more effective in generating ATP than not. We just know that they all do. And if you think about it, since sunlight contains all those moving parts, sunlight is obviously the best choice in which to do that procedure. And unfortunately, that's not the information that most people with TBIs get told.
Yeah, spot on. With my injury and with many other people that get concussions and they also get ligamentous cervical instability, often what seems to appear is that they recover, or they feel like they recover from the concussion, and then later on down the track, things start to come back, and that's often caused by a weakening in the neck that keeps getting worse. when these symptoms happen, this is due to the vagus nerve and the blood vessels getting impacted to the brain. What sorts of damages can that do throughout the body when something like the vagus nerve, which is connecting many different systems, and something like the internal jugular vein is getting compressed and is not happy?
Yeah, I'm going to be honest with you. I reject the premise of kind of your question, because I think there's a lot of, how shall we say, mistakes in your opinion. The vagus nerve predominantly deals with water chemistry, and collagen is dealing with the piezoelectric current. So you need to realize, as I mentioned earlier, something about the Kashi rule and the anti-Kashi rule. Once you understand that aromatic amino acids can change their aromaticity to change their piezochroma ability. What did I just say there? In other words, certain types of light create certain amounts of electric current. And it turns out, for example, the anti-Kashi chemicals, I'm blanking on the name, but I think there's one called azulene. It only works in methanol. What modern science doesn't realize is that our chemicals, collagen, work in water. This water-based system works. So when you have a vagal nerve problem, it's because your paraventricular nucleus, which is at the source of where the problem is, or the nucleus tractus solitarius, which gives input to the vagus nerve. The vagus nerve tells you that CSF is the problem. CSF around the brain. The collagen in the brain is a totally separate issue. And I told you before, you have the water network, the soliton that's in the neuron. That actually is tied to vagus motor power in the system. So it's not about compression of the nerve. That's total bullshit. Who's ever put that idea in your head, it's probably some fascial specialist that is operating way above his pay grade because he doesn't know biophysics. The vagus nerve is really all about water chemistry and hydrogen bonding network. The collagen is a totally different system. But the way in which these systems work together is through piezoelectricity. Different colors of light stimulate different electric spectral fingerprints within cells. So again, it comes back to what I told you earlier, that without knowing the lack of spectral deletion after an injury, you don't know if it's the jugular foramen. You don't know if it's the vagus nerve. You don't know if it's collagen. The only thing that you do know is the things distal to those systems, namely the fascia, aren't as strong as they used to be. Why? Because the problem is proximal to this. And since people don't understand functionally how collagen, the vagus nerve, and nerves work, you have to reconstruct this for them all the way back. And ultimately, the real diagnostic step is to know how the spectrum inside the tissues are bad. Ultimately, that always cycles back to mitochondria. Why? Because the mitochondria is where the source of the biophotons are through mitochondrial metabolism. When someone tells you the vagus or the jugular nerve, they are so distal down the system, they're never going to fix your problem. They're just going to put shit in your head and not be able to explain it to you. And in my view, this is really detrimental for people with TBIs. Why? Because you need to functionally understand truly what the cause of the injury is. And it goes back to light, water, and magnetism. It doesn't go back to the vagus nerve or the jugular foramen or even collagen. Realize that those things in the power plant are damaged because of the proximal problems that are related to very fundamental things tied to the electromagnetic spectrum of the tissues, the mitochondrial colony, but also the water networks. And water can be disrupted, in the vagal motor system. Most people don't realize that the floor of the vagus is in the fourth ventricle. The fourth ventricle in the brain is adjacent to the CSF. That's the reason the vagus is involved in this. Why? Because you need the water adjacent to the brain for it to functionally operate correctly. And therein lies the key.
Yeah, awesome. That's a brilliant piece of knowledge there. And if we're going to zoom out, how do we actually differentiate between the different things that could be going on because with this issue, there is no official diagnostic criteria. There's no process and there's no treatment process either. So how do we get all the pieces to fit together and go to the level that you've gotten to and actually be able to test that and understand what exactly is going on?
Well, it's pretty simple. I mean, all you have to do is run decentralized research protocols. First one would be using certain frequencies of light in the morning to see what the impact is on CSF. The other thing is sampling people's CSF. You don't have to do this in people. You do it in animals first and see what happens with the water network changes. See what the deuterium isotopic fractionation is in TBI patients versus non. My bet is you're going to see there's a much higher level of deuterium fractionation in people with TBI than those without. And that makes sense because they're going to have less energy that's be able to carry it as an electromagnetic capacitor in their brain. Should we be do testing on the vagus nerve? Should we actually do vagal nerve implants for people with TBI? The answer is it's likely going to help. Is that indication currently present? The answer is no. But these things are easily testable. Could we start testing people or animals with transcranial magnets, to see what the effect of ATP is on a tissue? Absolutely. And what you do when you do these decentralized research protocols, you actually begin to parse through the basics of the pathophysiology of this condition. And then when you do that and you find out, oh, look, it turns out that transcranial magnets are more substantial than photobiomodulation, then you say, you know what, we probably should use transcranial magnets before we use photobiomodulation, and then graduate to AM sunlight, because AM sunlight has all the pieces and parts that we're missing. And the progression to the next step is based on the redox potential that's present in the tissues. And how will we measure that? Okay, we'll come up with, say a software program on MRI to measure the cerebral metabolic rate of oxygen consumption, or to measure ATP production within neurons. There's many different ways of doing this, but the problem is the reason none of this is being done now is because modern centralized science doesn't look at the mitochondria first. It looks at RNA and DNA. And that is a huge problem. That's the reason we're not solving the basics of most chronic diseases, because we're looking in the wrong place.
Yeah. So then does those diagnostic tools that you've just pointed out and that process, does that then translate into the treatment process, or will the treatment process be different once you get those markers and you get that data together?
Well, I mean, the number one thing is you have to do the research and then parse the data. And then once you parse the data, then you check or come up with hypothesis for treatment, and then you test that and see which one is most effective. So the answer is, just because you generate lab data doesn't mean, oh, everybody should run out and buy a transcranial magnet. We don't know the answer yet, and it needs to be tested. That's why I said you need to do testing in mammals, and hopefully we use diurnal mammals to do this. I actually think you can do the first test in nocturnal mammals, because I think you're going to get the same results. Why? Well, I shouldn't say the same results. You're going to get results in a nocturnal mammal where you'll actually see the biophysical processes when you look at it. And then you can test it in higher order animals until you get to humans. Why? Because we have the most complex biophysical system in the animal kingdom. So to think that a lower level mammal is going to operate like us in a TBI is it's almost kind of like folly.
Yeah, interesting. And with the issue that I personally have, I find that not only am I light sensitive, but I also get the visual snow, the flickering light sort of covering everything. So would you be able to maybe differentiate between the light sensitivity and the visual snow and how they are different, and maybe the different things that are going on there?
Yeah, but that tells you right there there's probably a problem in the retina and in the visual system that goes through the leptin melanocortin pathway into the brainstem. I mean, when you have visual snow, that's kind of like a brownout. And that tells you that first order processing in the retina, which is part of the brain, is broken down. And that's not uncommon in people with TBI. In fact, if you were to ask me, I think most TBIs have evidence of retinal damage. And we have some interesting tests already that I think we should be running on people with TBI. For example, OCT of the retina. The reason I'm interested in OCT for a lot of chronic diseases, it's very, very cheap to do. And what does it tell us? It tells us about the layers of the retina. We know from ophthalmology studies what plastic thicknesses of the retina are. It would be very, very interesting to see in TBI if we can characterize the power of TBI or the level of degradation or injury from changes in layers of the retina. If you were to ask me based on what I know now, the place that I would probably look at the most is in the choroid plexus. That's where I think the data is going to be really, how shall we say, fruitful for TBI patients. And I think when you have changes in the choroid, it tells you about blood flow changes. Remember, blood flow brings oxygen. Oxygen brings the terminal electron acceptor to mitochondria. So that's the reason why I think that's the part of the retina that's the most interesting to look for. OCTs are non-invasive, don't use any x-rays, it uses light. We can generate a lot of data from that and get a lot of things done, even though we don't have, endogenous photomultipliers that we can inject into the ophthalmic artery to see truly what's going on, not only in the retina, but distal to the retina into the brainstem, where those nucleuses for the vagus nerve are. That can be done right now. The problem is getting insurance companies to pay for that because, we don't know if it works or not. That's really, to me, a waste of time. I mean, if you really want to start to help people understand the mechanisms of a TBI have been out there for a long period of time. We understand that mechanical disruption can lead to biophysical changes. The problem is we don't have any good tests that actually show the biophysical changes. And OCT is actually one of the tests that does that. Why? Because size and shape changes of the retina tell us about thermodynamic changes that are happening at the tissue level. And we know anything that loses energy gets bigger naturally. So we should be looking at thickened choroid plexus in people who have TBIs or multiple TBIs, especially if you've had 2, 3, 4, and you see that it gets bigger. If you go on to develop, cervical instability, you may be actually correlate that with the changes in your choroid plexus. I should say in your choroid, in your eye.
Very, very fascinating there. One of the things that I've noticed, especially with the visual snow, is that when I wear the blue light blocking glasses, even outside, it does reduce the visual snow quite significantly. So does that maybe even point to the fact that I could be blue light toxic, or what would you take of that?
Oh, or it could be that you don't have enough red light being generated in your eyes. That's the other possibility. See, to me, the fact that you put the blue blockers on, it makes you better. Immediately, I think about the complementary color. We know that the antidote for blue is red. So the first thing I think about when you say that, it tells me what's happening in the choroid at your eye, that maybe you're missing spectral frequencies from 600 to 1,000 nanometer. And therein lies the problem. See, that's where the next level test would be helpful. Let's see what the dyes are doing. Like, for example, most people don't even realize that hemoglobin is a red dye. And people further forget that the first step in heme synthesis occurs in your mitochondria. So realize that hemoglobin itself is a marker for mitochondrial redox. So if your hemoglobin doesn't emit proper frequencies, and people forget that hemoglobin has dissociation curves, we always talk about that based on the oxygen tension there. I think what we're going to find out is that it actually has light curves and it also has temperature curves. So do I believe that light and temperature changes lead to the spectral frequency changes of proteins and cells? And this ultimately deletes certain parts of the spectral frequency that cells rely on to function deeper in the brain that actually cause the symptoms of TBI? That's how I look at TBI. That's how I think about it as a neurosurgeon. I can tell you there's very few people in the world that look at it the way I see it.
Yeah, and I think that's very important that, as you say, we take a decentralized look at these things and we're not just going to try and tick off boxes on a checklist. And on that, when I myself am living at the 43rd South latitude, what effect is that going to have on recovery of an injury such as concussion or any injury?
Well, it depends. See, I said that earlier, that in TBI, being at a low latitude actually could be a benefit if you had all the other things present. But to be honest with you, do I think when you get through secondary, tertiary, and quaternary, say, healing phases, that ultimately latitude is going to be a problem? The answer is yes. Why? I think having optimal sunlight is imperative for healing. We actually know that from wound healing data. You know, most surgeons who will listen to this know that we'd like to operate in a day. Most people don't realize that we got that answer from the Greeks and Romans, because when soldiers were injured, they always healed better in sunlight. That's the reason why surgeons tend to operate early in the morning. And we've known this literally for over 2,000 years. The funny part is centralized medicine today acts like, you know, none of that literature exists in the wound healing literature. It absolutely does. So I think once the brain is a little bit different tissue than, you know, say your skin or skeletal muscles, there's a progression, I think, that has to happen there before you treat it, say, like a skin wound or a knife wound. But ultimately, do I think to really get total tissue regeneration, or as best that you can as a human mammal, you're going to need strong sunlight at some point later in the injury to help that.
Okay. Yeah. Awesome. Perfect. Now we are kind of running out of time here. I've got another 3 minutes before this thing is going to time out. So I'll try and fit in as many other questions as I can. I was thinking about my sleep cycle as well as the light cycle as well, being in the dark. Is the light coming off the moon, does that impact melatonin or sleep in any way, or is that nothing to worry about?
Yes. Remember, in Spanish, the moon is called luna. In fact, here last night in El Salvador, we had a full moon. It was very bright. The name lunatic comes from Luna. So yes, no question about blue light from the moon affects people's frontal lobes. The other effect is actually on the reproductive cycle, especially in women. We actually still see that effect. We've lost it in humans because of artificial light pollution, but we still see that effect in corals. Corals still generate sperm in the middle of the night during full moons. That's actually how they reproduce. You live in Australia, you got the Great Barrier Reef there. You guys can look that up pretty easily on the YouTube video and see the spawning effect.
Yeah, awesome. Thank you for that. I reckon this might have to be our last question, but when we're talking about food, I know you generally don't like to talk about it. Being in Australia, it's pretty easy to understand what's going to be natural and what's not going to be natural. Does that mean that because naturally there aren't really any fruits that grow here, that fruits shouldn't really be eaten at all, even in the summertime, because they're not from here, or in-season fruit is still okay?
I would say that's the answer. You talk to a farmer and say, what can grow at this latitude, longitude, and magnetic flux, and then stick with that. If nature provides it, it's not a mistake. If nature doesn't provide it, it's a mistake. And this goes doubly if you've got a TBI and you're trying to recover from it. Because remember, what is your mitochondria? It's an electromagnetic barcode reader of food. So if you've got damaged mitochondria and you're feeding it things that really don't grow in the area that you're at, you have just compounded your recovery from TBI.
And that is also synonymous with the time of year too, I'm guessing.
Absolutely.
Yeah, awesome. Thank you very much for your time, Jack. Unfortunately, this thing is about to run out. I really appreciate it, and I'll keep following along. And yeah, thanks for the interview.
All right, take care.
Awesome. Cheers, mate. See ya.
Bye.